Well, hey guys, and welcome back. My name is Jessica Leichtweisz. I'm the CEO of Hope Education Services. I make videos for parents to help get your questions answered. Parents sending questions all the time to my email, through my website, hopeeducationservices.com. Sometimes I can answer those questions, and sometimes I can't. And sometimes I get the privilege to bring on really amazing people like Dr. Robles, a developmental pediatrician, who can answer your questions better than I can. So parents sent in a question saying, what are some of the first things I can do if my child gets a diagnosis of autism to make sure I can best support them and give them the best chance they can to really reach their fullest potential. So Dr. Robles is going to answer those questions on some of the things you should do right after you get a diagnosis. So thank you so much, Dr. Robles.
You're very welcome, and thank you for having me. I think that's a really great and important question to answer. So I do want to say it kind of depends on where you get your diagnosis of autism. You know, sometimes you can get that diagnosis through early intervention, which is not a medical diagnosis. So one thing that is important is, yes, you're connected with early intervention, which is very important because you want to get those services in place with some therapies, but you also need to ensure that you have that medical diagnosis confirmed, and that is usually with a developmental pediatrician, because in order to get things like ABA or applied behavior analysis therapy, you do need that medical diagnosis. That could also be done with a psychologist, again, as long as it's medically confirmed, so that your medical insurance can then cover that therapy, which is really important. And usually you want to try to get connected with those specialists right away, because our wait lists are pretty long. Sometimes it can range from a few months all the way up to a year in some cases. So you really want to try to connect with us as soon as possible and talk to your pediatrician or your primary doctor about that. And you also just want to make sure that you, like I said, you get connected with all these early therapies as soon as you can. So if your child needs speech therapy or occupational therapy, and especially ABA therapy, I think the earlier we can get your child into these therapies, the better the outcomes.
Yeah, absolutely. Thank you so much, Dr. Robles. So I always tell parents, number one, don't be afraid of the diagnosis. A lot of times parents are afraid of it, afraid of the stigma, afraid of the label. But the truth is that I tell parents, and this is not a definition of your child, it's a diagnostic code for insurance to pay for services. So don't look at this diagnosis as the be-all, end-all of who your child is, but know that if you want to best help your child, in order to get the funding, a diagnostic code is needed. So I always tell parents, if you're worried about the diagnosis, don't look at it as getting a diagnostics, look at it as getting a diagnostic code to appease the insurance company. And always start. Parents ask me, well, I was concerned at 15 months, should I give it another 6 months? I always say, look, if you have a 6-month waiting period, you can cancel the appointment a week before, but don't wait 6 months until you're confirmed, like, wow, now I really think there's definitely a problem. And now you have to wait another 6 months to start getting help. So that's fantastic advice, and thank you so much for sharing it. I really appreciate you coming on here. You know, if you have a question as a parent, I'm passionate about helping get them answered. Head over to my YouTube channel, getautismanswers.com, subscribe to the channel. We post videos just like this all the time. And if you have a question, just simply drop it on this video and I will make sure we get it answered.